Chairman Moran, members of the committee, I am pleased to testify about the oversight conducted by the Office of Inspector General regarding VA's medication management practices. A fundamental healthcare activity is a medication reconciliation process involving providers, patients, and their caregivers that ensures they are aware of all medications a patient is prescribed and taking, including over-the-counter and supplements. Medication reconciliation, required by VA, can be time and labor intensive, but it helps verify that patients are taking their medications as prescribed and that each medication's risk and potential side effects are understood. It can also reveal or prevent duplicative treatments, contraindications due to allergies, and potentially dangerous drug interactions. Medication reconciliation is most critical during care transitions, such as when a patient is discharged from a hospital, moves between different levels of care, or receives VA and community care. For those patients with chronic or difficult to treat conditions, including mental health conditions, the risk of polypharmacy, being prescribed multiple medications, is real, but it does not always mean a patient is receiving poor care. Veterans are at higher risk for psychotropic polypharmacy, that is, being prescribed more than 2 medications that affect mind, mood, and behavior. This can occur because of their distinct military experiences that lead to complex and treatment-resistant mental health diagnoses. The OIG has noted deficiencies in medication management in several of our reports on VA healthcare. We uncovered noncompliance with required processes for patients being discharged from acute mental health care settings. For example, only 37% of electronic health records at the Philadelphia VA included clear discharge medication instructions, which are essential to prevent medication errors post-hospitalization and ensuring continued recovery. Patients must also be educated on potential risks associated with their prescriptions. Many antidepressants, for instance, carry black box warnings due to their increased risk of suicidal thoughts, particularly in young adults. One tragic case reviewed by the OIG revealed serious deficiencies when a young veteran, who ultimately died by suicide, was prescribed an antidepressant without being educated on the risks and was not provided timely follow-up care to evaluate responses to this new medication. This case highlights the critical value of patient education and timely follow-up care. In addition to challenges with safe prescribing within VA, the OIG is concerned with safe prescribing for veterans receiving community care. A significant troubling area remains the oversight of opioid prescriptions written by community care providers. VA is required to ensure community providers review and acknowledge VA's Opioid Safety Initiative guidelines. However, we found inadequate oversight of VA's third-party administrator's certification that community providers reviewed these guidelines. When community providers are not even aware of VA's expectations for safe opioid prescribing, VA cannot guarantee the safety of those veterans referred to the community for chronic and acute pain management. Our review of the VA Eastern Kansas healthcare system highlighted further inadequacies in coordination and oversight of medication management involving community providers. Among other issues related to patient safety for veterans referred to the community, we found incomplete documentation verifying safe opioid prescribing practices and a lack of documented medication reconciliation by community providers. In conclusion, VA's dedicated clinical staff work tirelessly to provide high-quality care tailored to each veteran's needs. Such care can involve multiple treatment modalities and medications. Patients and caregivers must be empowered to manage their care with accurate medication instructions, an understanding of treatment expectations, and knowledge of potential side effects for each medication. The OIG is committed to independent oversight. Our teams of dedicated medical professionals are uniquely positioned to assess and drive meaningful improvements in the quality of care delivered by both VA and community providers. Chairman Moran, Ranking Member Blumenthal, and committee members, I'm happy to take any questions you may have.